Coming to infections, the commonest of the infections which could happen would be Trichomonas vaginalis, Candida albicans, bacterial vaginosis, chlamydia, gonococci, and you would also think in terms of HIV, which we will not discuss here. Trichomoniasis usually happens around the childbearing age, but it can happen in any age. It is sexually transmitted. It's a profuse, thin, creamy or slightly green color, and it is frothy white discharge because trichomoniasis are motile organisms and have got an undulating flagella, so it can beat very well. When the secretions get beaten up, they produce froth. So when it's frothy, always think in terms of trichomoniasis. The vaginal walls are tender, and when you put in a speculum, the vagina will be strawberry vagina. It will be pink in color, and that itself tells you that it is trichomoniasis. Patients may have history of dysuria, urethritis, backache, and dyspareunia, and you could do a wet mount preparation, and you could not see the organism, but you could see the darting motility of the organism, which moves quite well. And if you want to view the organism like what is shown here, is you could see only under an electron microscope, which is not worth trying. So you could grow the organism on a very rare culture called as Wintington-Feinberg's medium, rarely done. And how do you treat the women with trichomoniasis? You need to give them metronidazole 200 mg 3 times a day for 7 days for both partners. Abstain from sexual intercourse, and use of condoms is recommended during the period of treatment with the metronidazole for her. If it is severe enough, of course, you can put them on inpatient and give IV metronidazole and treat the partner with a oral tablet. Why do I say ornidazole 1 gram orally for 3 days? Because there could be women who cannot abstain from alcohol. Metronidazole with alcohol, or the husband who takes alcohol with metronidazole, can have disulfiram-like reaction, and metronidazole can produce a metallic taste in the mouth and of course gastritis. So ornidazole is probably a little one shade better drug when compared to metronidazole because it is devoid of that, and you could take ornidazole with a pint of alcohol also, and does not produce gastritis or a disulfiram-like reaction, and so you could use either one of them according to the patient's convenience and need.